Okay, I'd like to call this meeting to order, and let's all rise and say the pledge of allegiance. I pledge allegiance
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
call the roll. Unfortunately, Kimberly sent me a text, really just before I was gonna go pick her up, that she's not feeling well and was not able to come today, so she has an excused absence. Glenn. Here. Jessica. Here. Mark.
Here.
Crystal. Here. Gail.
Here.
Beth. Here. I'm here. Marcia. Here. Jane. Here. Deb. Here. Karen. Didn't hear from Karen at all. Okay. Public comment. Is there anyone from the public who wishes to address the board? Anybody online? I'll be time later if somebody does. For the agenda, does anyone want to make any changes to the agenda as presented?
Might note that the agenda called for a presentation with Senator Albertitz at this point, but he is set to arrive at 6 p.m. So that's the delay on that.
So when he arrives and he gets kind of settled, I'm gonna say hi and I'm gonna pass it over to Mark and he'll take it from there.
Okay.
Okay. Did I get a motion to approve the agenda?
Move to approve.
Support? Support? Any discussion? All in favor, say yes.
Yes.
Opposed? Let's take a minute. I wanted to present Jane a plaque and honor and gratitude to your service. We hate to see you leave, and if you ever get a new house in Allegan County, let us know.
Absolutely.
Yes. So,
I would.
Can I get a picture of you while you're doing that?
sure.
Well, actually, looks a little nicer.
Thank you.
Thought I'd also take a second to just explain again why we were passing a card around. Mark let us know that Megan has let us know that she has taken another position. And it sounds really pretty exciting for somebody who's 20-some years old, that she's been offered a new job that gets to do something that she's discovered she really loves to do, which is project management. And I have discovered that there's actually a certification for that you can get. And this new job, she gets to do it, and they're going to help her pay for or go through the training to get that certification. So kind of a no-brainer for her. So we're very pleased for her, and I, want her to be sure she checks back in with us and lets us know how things are going. But I did want to be sure to pass it around so that we can, because she's on vacation right now. She comes back next week, but her last day is March 26th. So we won't get a chance to actually see her before she's gone.
Thanks to Christine for covering for her tonight.
Yeah,
That was pre-planned.
definitely.
Yes.
Okay. The next thing is the consent agenda. Does anyone wish to remove any of the items on the consent agenda in order to discuss them individually? If not, can I have a motion to approve the consent agenda as presented?
Move to approve.
Second. Support. Any discussion? All in favor, say yes.
Yes.
Opposed? Motion carried. All right, Jane, for the last time, can you let us know what, transpired at the program committee meeting today?
Absolutely. Well, we had one, presentation, other than, Gina's report. Janine gave a riveting, summary of evidence-based practices. It was actually very, very good. She talked about implementation science and, how we apply that into our system, bridging the gap between what has been developed and incorporating that into our existing programs, and then how do we sustain that? She gave a nice overview of what OnPoint has done for 2025 and what the projection is for 2026. If you haven't picked up the packet on the evidence-based practices, it's packed with a lot of good information. I would highly suggest going over that information. And then again, Gina gave us a report of what is going on currently, which I'm sure she'll go over in the full board meeting as well. So that's my report.
Any questions for Jane? I'm sorry I missed it, darn.
Do it again.
All right, thank you. Beth, will you give us a report from today's finance committee meeting?
Sure. Probably the biggest news out of the human resource part of the report was that, most of the annual performances have been done, like completed up to 97%. The average merit increase was 2.7. In 148 people of this organization out of 165 had some type of merit increase. So it was like 89%. And that was kind of reassuring to know that even though it's performance-based and merit pay increases, it's very attainable for all employees. So that was kind of the big one. Folks for fun, they have a new planning committee, and we all are anxiously awaiting the new events for 2026. Moving on to information technology. What do we have here? Oh, the big news there is we are moving from a government cloud to a commercial cloud, which will allow all our software to talk to each other. And there's a business central piece in it that just kind of allows all the data to come in and make any types of reports you like. So better data, better decisions. So that's a good thing. As for the MAT room, it's going to be completed on the target date of like the first quarter. So looking at the 1st of April, moving in roughly. So roughly, we'll take it.
Beginning the furnishing process.
Yes. So, moving on to page 7, we have to pay the bills this month. So I make the motion. I'm sorry, that's okay. I was waiting for it. I make the motion that the OnPoint board approve the February 2026 disbursements totaling $3,674,243.74.
Support. Have a motion and support. Any discussion? I'll go ahead and take a roll call vote. Glenn?
Yes.
Jessica? Yes.
Yes.
Crystal? Yes. Gail?
Yes.
Beth?
Yes.
I say yes. Marcia?
Yes.
Jane?
Yes.
Deb?
Yes.
And pass.
Okay, moving on to page 8, we have a few more providers that need to go on the contract list. So I make a motion that the OnPoint board approve the following list of provider contracts for fiscal year 2026 as listed below.
Support for that? Support. Crystal? Any discussion with that? Deb?
Yes.
Jane?
Yes.
Marcia?
Yes.
Say yes. Beth?
Yes.
Gail?
Yes.
Crystal? Mark?
Yes.
Jessica?
Yes.
Glenn?
Yes.
Motion passed.
Okay. Moving on to page 11, onto the financial reports. If you go to the far right column and the Medicaid subtotal of that 684,000, that is expected to go back to the LRE. Moving down to the general fund, sorry. The 22,000, that will not be going back to MDHHS because it is below our 5% threshold. As for the CDHC visits, they were down in January by a considerable amount, but we had all that bad weather, so no one drove on those bad roads. Currently for this year, we're budgeting the CCBH rate at $370, and Millman in May should have the actual ready for us, and we're hoping it might fluctuate by about $10 plus or minus. So things are looking good there. Any questions on that thing? Okay, moving on. St. Patrick's Day, people. On page 12, our cash is good, kind of a broken record, over the past few months that, our surplus of that 3.3 in the cash and cash equivalents that is holding, some of our investments and the surplus that needs to go back to the LRE. Down in the liabilities, through the first 4 months, that the accounts payable, that 1.9, is looking that the prior years, like hospitalization, still in there, still need to pay that. Due to other governmental units, that 2.3, the Medicaid that has to go back to the LRE is in that dollar amount, but we're also starting to build up for the 2026 that usually has to be given back. So that number's pretty large. Going all the way down to the bottom to the net position, what is unrestricted is 3.4, and that's a very solid, healthy number for us. Okay, any questions on that page? All right, last page, page 13. We're 1/3 of the way through the fiscal year, so we want to have 33% in the far right column. Couple of places that don't have that is that 0% of the revenue of the quality bonus payment. It just hasn't come in yet. It's usually around August. It's kind of a placeholder, so that's why that's 0. Down in expenses, there's 58% for supplies and materials. Allegan County and OnPoint have bought a lot of computers. We did 80 laptops because the increase in laptops is coming. Yeah, computer equipment. So we got ahead of that a little bit. Professional development and this occupancy, that's just seasonal stuff. Conference season hasn't revved up yet, and Andre won't, wash the windows or clean the carpets until after the muddy season, he said, so. Well, that's what he said, and I agree with him, but overall, total of revenue was at like 31.9, total operating, expenses 31.8, so you always want to match your revenue and expenses, looking pretty solid there. And we have a change in our net position of 79,000. It did decrease a little there, but, yeah, it's currently 159, but the change was the 80,000. And what was that from? You told me.
You asked me why it went down.
Yeah.
A little bit, just due to the CCB.
Yeah, January, we kind of fell off on our visits, but they're already looking at March and February and early March, and we're bouncing back already. So everything looks pretty solid again. So any questions? Okay, thank you. That's the end of the report.
Thank you very much. Fun. The recipient rights committee met today.
We did. We did, and we had a very good meeting, so we'll start on page 20 and go backwards. Because we had a discussion on layout. So you can see, the goals have not changed. They're on track with their annual goals. The timeline report, timeliness, everything is very good. We have nothing outstanding over the 90 days, which is excellent. Moving on to page 19 and 18, we have Kelsey to put together a graph so we can start visually seeing what we're doing. You did a fantastic job with that. The one comment that was made by Kelsey is that November, December, January were quite heavy months for abuse and neglect allegations. And we did have some good discussion about increasing preventative trainings versus remediation, the term I believe we use. Okay. So Kelsey and her team are going to be focusing on more preventative to get ahead of the game, which is excellent. And then on page 17, it's the number of allegations for the quarter, December to February. And also had Kelsey add the definitions of abuse and neglect, and the neglect category will be changed to neglect. Just a copy paste typo.
The definitions are correct.
Definitions are correct, but where it says abuse 1, 2, and 3 under neglect, it should say neglect 1, 2, and 3. So she got caught with copy paste. But, and so the number, Kelsey made a remark that the numbers, there's no, going back to the graph. She was surprised that there are no significant trends in the series of allegations because it seems to be a seasonal thing, but in a way it's not in the big picture. Any questions? And that's it.
That's it.
That's it.
All right. Thank you, Glenn. Hey. Stephanie? Are you there?
Yes, I'm here.
SB?
All right, good evening. I just have two very quick updates for you. Wanted to let you know that last week, Wednesday, our Oversight Policy Board met, and one of the things that they did was they changed the bylaws. As a reminder, that group only meets quarterly, and we're struggling to meet quorum. And so they changed the bylaws to ensure that members who are there do need to attend all 4 meetings throughout the year or have an excused absence for being sick, things of that nature. We listed those out in the bylaws. In the event that doesn't occur, they're asking that us as LRE staff then notify the county administrator to let them know to perhaps appoint somebody else to the group. So anyway, just wanted to let you know that was a big change and the group requested that. So we did put that through last week. And then that group will meet again on June 10th, which happens to also be the date of the summer conference. So we moved the time to 5 p.m. to allow for people to travel back from Traverse City. And then the last thing I want to leave you with is we do have our full board of directors meeting next week, Wednesday, the 25th. It will be at 1 o'clock in Muskegon, Grand Valley's campus, and we are not having a board work session this month. So just wanted to let you know those 2 items.
Questions for Stephanie? I see none here, so thank you, Stephanie.
Thank you.
I have so much stuff to hand out here. Maybe I'll start with this. So this will be, where we get into the other things. We have one person who has completed their board works, and that is Deb, and I wanted to present. Probably good. Oh, no picture?
Oh, sorry. It's rare to be asked, it's good. Congratulations. You're a role model for new board.
Yeah, thanks. It's got to be a record for this long winter. Oh, okay.
Blame it on the snow. Okay,
Thank you.
all right. Actually, maybe that's the way I want to do it, is talk to, the next thing is the bylaws. Remember, we've been talking about this and we've looked at it, and the main thing that we are recommending that we change in the bylaws is the section on compliance that Diane asked us to see that it's no longer yellow. Where was it?
That's the bottom of the executive committee section. Page number in front of you there. Yep, got it.
Okay, page 5 is executive committee. I think it's at the top of the page 6, that paragraph there.
Yeah.
And it basically is just saying that the executive committee is going to serve as the ongoing compliance oversight committee. And that way we do it, and this way it's in our bylaws and we can kind of document we do it. In case anybody questions whether the board is, overseeing the compliance bylaws and her provisions. Did anybody see anything else in the bylaws or the policy and procedure that we would want to change? If not, I'll take a motion to approve the changes to the bylaws and the policy and procedures as presented.
Make a motion to approve the bylaws as presented on March 17th, 2026.
Support. Any discussion? All right, all in favor say yes.
Yes.
Opposed? Motion carried. Okay, the other quick thing would be, we handed them out last month, the conflict of interest. Whether we, that form that we need to say either we have one and what is it, or that we don't. And has everybody, I filled one out last time and submitted it. I don't know if we have a tally of who you still need to collect that from. Or
I think I have Kim and Karen here.
don't have Alice?
Should have mine.
I turned mine in last week.
These are the ones that remain to be signed.
Oh, remained. Oh, okay.
Okay.
I see what you're saying. So we can assume everybody else has already signed it?
I have not heard otherwise.
Okay, let's make that assumption and figure out that. Okay, great. All right, well, I just saw Senator Albert come in and, I was gonna say. Oh. Sorry, wanted to welcome you, and Mark would like to, go ahead.
Yeah, welcome to, glad to have you here. Thanks. Why don't you come out up here? I don't know if you had comments you wanted to start out with?
Sure, that'd be fine.
Provided you with a copy of that, of course, ahead of time.
Yes, thank you.
That would be some of our, hopefully, opportunity for dialogue back and
Yeah,
forth.
love
But
that discussion.
certainly welcome you to say whatever you need to say or would like to say, and just glad you came.
Great, thanks. I guess first I'll start with Happy St. Patrick's Day. I see a good amount of green. Well, here. win the award for, best dressed.
Very much so.
But I guess first off, just, thank you for all that you do for taking care of some of our most vulnerable in Allegan County. So, really appreciate all the efforts that you guys do. I'll just give a couple of quick comments and then love to have a discussion with whatever you guys want to talk about. I would say the biggest issue was the potential change that was on the docket for public funds for mental health care, and how they're managing the state. And we saw the recent case that was in the Court of Claims, and the recent decision that stopped the request for proposals because it violated, if it would have gone into place, would have violated various statutes that we have that our CMHs are responsible for our statewide. And the lawsuit also raised concerns about undercutting funding and jeopardizing care. So that's a huge concern. It's worth keeping in mind the judge did not halt the state's ability to use competitive bidding as a whole. But it did require that any future one is in legal compliance with our current laws. The state has since rescinded the request for proposals, and we're back to the drawing board. So while the immediate issue may be temporarily addressed, the underlying question of how or whether or not we modernize or change Michigan's behavioral health system remains unsettled. And I guess I just want to let you all know that in the legislature, I want to be an advocate to make sure any type of change of this magnitude is done with legislative input. So people like myself can work with our local CMHs to make sure that whatever changes are made will actually have good outcomes and help our communities. So I really am a strong believer that DHHS should not be making these types of changes unilaterally. There needs to be a better process. So outside of that, that's kind of the biggest issue, I guess, for the CMHs that we've seen over the last year. But outside of that, I would say that the next biggest thing is probably the budget. The governor, I think 3 weeks ago, came out with the executive recommended budget. I would expect the House and the Senate probably vote on their first proposals typically end of April, first week of May. And then they negotiate back and forth in conference committee. And I can't make any promises, but I do think that the budget should be done by the end of June this year as our statutory required deadline. Again, that's not a promise. You don't hold me to it, but that's just I've been doing this for almost a decade now, and it feels like that's the most likely course of action. So I guess one last thing, when you look at the executive budget recommendation, looking at mental health, probably I think one of the biggest changes in there is funding to transition staff, supplies, and materials to the Southeast Michigan State Psychiatric Hospital. And that's been under construction, and it's planned to open up in October of this year. So that was a big deal. It was over, I think, over $380 million project. So it'll be good to have that up and running. So that's a quick update. Happy to discuss anything that's on your guys' mind.
Thank you for those comments. We really are, again, pleased to have you here, and those are really relevant points for us to discuss. And they do capture some of the things that were listed in that document we provided to you and are available on the tables for others. I think as we think about, our system has always been a system that has had times where we are struggling with finances. Usually when the economy goes bad, our demand goes up. It's like we call it counter-cyclical, right? So people become increasingly dependent on public funding at a time when it's really stretched to its maximum. So I'd love to figure out a way for us to somehow intervene in that to make sure that those are not times in which the systems that people depend on are disadvantaged. But going back to the budget, as you talked about with the recommendations and so forth, this really is important that adequate hospital facilities exist, and the facilities that were in place in Southeast Michigan were due for replacement. So we're glad to see that too. And there have been some additional facilities brought online, not state facilities, but private facilities licensed and opened in West Michigan. So that's been good to see as well. One of the things that I think as we think about the array of services that we're offering here, I hope you've been briefed a little bit on the Certified Community Behavioral Health Clinic. The movement to bipartisan effort has been nationally to try to increase the availability of behavioral health services through clinics that are much like federally qualified health centers. But on the behavioral health side, they're certified behavioral health clinics. And the state is in the middle of a demonstration project under the feds to experiment with the model of delivery of services that offer a guarantee array for people regardless of their insurance and situation. And that has been really, really positive here. If you had been here a little bit earlier, you would have heard a report on the way in which it's not only transformed the access to services, but also made us very much a different kind of organization because we, are paid by the services we do rather than simply receiving funds to, administer throughout the year. But I think the thing that we wanted to start out with, and it sort of begins that document, back in 1969, when our community was first forming a community mental health agency, the vision of the Board of Supervisors at that time was to create an array of services that were accessible to all people in this community who had needed that help. And even though in their minds, the folks that they were thinking about were those that were in institutional care, the words themselves were very broad to provide comprehensive mental health services for the entire county. And that's really what CCBHC services have allowed us to do for the very, very first time. So that has been a real blessing to the community in that we're able to respond to all kinds of needs in an environment here in Allegheny County where there aren't a lot of private providers like there are in some larger, more urban counties. So that's an area of support that we really would love to have you help us support. I think the budgets they've been implemented last year, and the language for this year talks about putting caps on those, the growth of those clinics. And we really do need to see statewide the expansion of those so that every community in the state can have equal level of services. And you're not at a disadvantage if you happen to live in a northern region that needs an adaptation of that model to be able to make it work in a less dense population. So that was one of the first things that we wanted to emphasize, is that providing excellent care to all of our neighbors is a really important goal for this agency. And I'm glad you touched on too the role of the legislature in our second item, which is really dealing with the state's response to an RFP that seemed out of left field. I've worked in the field, the public mental health side personally since 2004, and in the private sector before that. And all along the way, there have been movements to kind of change or adjust the nature of the public system from going to contracts with just 46 CMHs or 48 at that time to having these PHP structures that receive the funding and broaden the risk pool base and allow for there to be relationships amongst CMHs to work together in regions. All that has been done. Even if you don't have an opinion about whether they were good ideas or bad ideas, the best part of it is that it was done collaboratively with the department. And this RFP for the first time was an effort to make changes in the system that was completely without dialogue. And as we said at that time, and as we say today, we as a system are eager to sit down with the department and try to collaborate toward what are your items and your objectives? What are the needs of the communities? And how do we find best ground for the continuing need for improvement in our systems? So we look forward to that opportunity. And I think you're absolutely right. The legislature needs to play a very strong role in systems change and enabling the good ideas that come forward, and honestly protecting communities against ideas that aren't good. So that's a role we're really eager to have played. We talked a little bit about staffing shortages and the difficulties that we've had in helping with this area. One thing that changed rather interestingly in this area, Allegheny County was dropped from the list of counties that are considered medical shortage areas, medical professional shortage areas, and really not much from our experience has changed in terms of like having suddenly an influx of behavioral health staff in our communities of mental health providers. We've grown, but I'm not sure that we've grown to the point where we don't need to have the tools of the state to help us with recruitment and retention of good folks. One of the things by that, the designation that Michigan, the Health Research Systems, the federal agency with the state does, is to designate certain communities as being shortage areas. For example, we are a medical shortage area right now, but not a behavioral shortage area. And why you'd say that, I don't know.
And that's a federal designation.
It's a federal designation. The governor actually has some latitude to designate them personally, just if she wishes to do so. But we've lost that designation. And we had an experience this year where we were recruiting a psychiatrist to come aboard. And at the very last minute, the question was asked, do you have the ability to help with student loan payment issues as a county that would be in a shortage area? We checked, we thought we were. And all of a sudden we find out we're not. And she has to go where she can have that availability. So those kinds of things are that's confusing. So, again, we're not asking you to fix that, but understand that we do have needs here, that if you have any insight into that, we really would love to hear it. Because we do want to take advantage of any resource that helps us to gain the staff we need to do the work that the growth of our CCBHC program, for example, has called for. More social workers, psychologists, psychiatrists, things like that. So I think the other item I want to draw your attention to, you mentioned, of course, the PHP bid out. There's another thing that the department is working on called the mental health framework, which is sounds like innocuous enough language, right? But what that involves is the department is wanting to, what their stated goal is to increase the accessibility of emergency services in a community by having Medicaid health plans, of which there are 11 in the state, 6 of them in operation in Allegan County, have the ability for them to take responsibility for evaluating and responding to emergent and non-emergent needs. So people who show up, for example, in an emergency room across the street at the new Beacon Health Facility and need to have an assessment for hospitalization. The current process is that they call us, we do the evaluation, and we authorize the care, and system moves on. The system in the future that they're talking about is, if you want to bring the Medicaid health plans into that, first of all, figure out, does the person who's in the ER have Medicaid? If so, which health plan do they belong to? And then contacting that entity to be able to make the decision about whether or not the benefit applies to that person, and then the authorization is given or not. It sort of feels like it complicates the situation where currently we have kind of a one-stop shop on that one. So the mental health framework, it may be well intended, but it doesn't operationalize very well. The Michigan Hospital Association doesn't approve of this move. Medicaid health plans do, but not the move. And we think at the end of the day, what this feels like is it's an opportunity for a slice of Medicaid funding without really a good track record of providing services to the beneficiaries. So we're leery.
Is that a
about
DHS proposal?
Mm-hmm.
Not bad.
Yeah. I would certainly provide you with a lot more detail on that, but their intention is to have that in place by October 1. And at this point, it's simply a administrative decision and not anything that requires legislative approval. So that's something for us to be concerned about together with you. I don't know so I know for sure that none of the other CMHs that exist within your region or within the state serve as the housing authority for the communities they serve. We happen to be the agency that is the homelessness response agency as well as the community mental health agency. And it's a beautiful thing to be able to combine the services that we offer to people who are homeless. If they happen to need behavioral health care, we can certainly coordinate that at that time. And additionally, people who have certain kinds of case management needs, we are able to provide services for them under the Medicaid umbrella as well. And, we're in a community that doesn't have a great amount of housing resources in the first place. So that's a need. But we really like the ability to kind of provide that coordinated care. And just want you to be aware that we're doing some really good things here. And I think the state has appreciated some of the work we've done, particularly in that case management arena and in providing some apartment-based shelter in a community. The county does not have standalone shelter facilities. I've worked in communities that do, by the way, and will say that they're not always the solution that people think they are, because some needs can't get met there. There are people who have pets that won't leave them. We have, anyway, there need to be a lot of solutions, and I'll say that some of those facilities sometimes attract problems as well as they solve them. So anyway, we're doing some really interesting things there. Finally, there's just a couple of requests. We work together closely with our regional entity around tobacco, youth tobacco use and marijuana exposure. And there's a couple of bills that are currently under consideration in the current legislature, and I've listed those there, their current status. And we certainly would encourage anything that can be done to help strengthen requirements for tobacco retailers. Right now, tobacco sales are not licensed. If I walk into a store as a teenager and I go to buy a package of cigarettes and somehow or another, it gets notified that the clerk has just made a sale. The clerk gets a ticket, but the owners don't. There's no accountability to the operation. So there's some improvements there. And also, we've limited tobacco advertising on billboards, and we're careful about where we alcohol, but marijuana advertising seems kind of ridiculous these days. And we would encourage as much as you can to help limit exposure of children for marijuana advertising. So those are the issues that we just wanted to share. And I just want to open the door for any other comments. We have a lot of folks in this room who have worked with children and families, who have children and families, and would like to just give you an opportunity to say anything you'd like to add to that.
Any questions for the senator?
I do.
Okay.
With this RFP, as I understand it, some of the motive behind it was to privatize, the funding. Is that true?
Yeah.
Okay. Are you in favor of privatizing the funding for mental health?
I'll say this, I would not be in favor of a revolutionary change of that nature without really digging in and understanding the issue. And this is one where I would really need to learn more about the whole system and how it works before I would support revolutionizing it. So
Even if it wasn't revolutionized and flipped on its head, but just simply privatized, would you be more open to it?
I would say I'm hesitant to do something of that nature. It's hard for me. I just don't have enough knowledge on the entire system to make a definitive answer right here, right now. But I would say I'm hesitant of having that large of a scale change. I'm more supportive of prudent reform. So finding areas where there is areas of improvement and trying to fix those kind of one step at a time. So I would look more with step 1, step 2, step 3, and so on, rather than just doing a giant change that would be a wholesale sweeping change of the whole system.
One of the reasons I ask this is that the fear of privatization is that services will be less in the local control. So are you in favor of, even if this is privatized, are you in favor of having a framework or a structure that keeps the control of services at the local level?
Yeah,
The decision for that.
for sure. I would say as a governing philosophy, I most definitely try to support decentralization as much as possible. Absolutely.
Thank you.
Just comment on that. I think that's a really good point. Sometimes the private public thing gets sort of talked about as if they were enemies of one another. We manage a lot of public resources that go to a lot of private organizations through this entity too. So private organizations for us are, we really rely on. And the fact that there's choice among them, that's wonderful, that kind of thing. But again, local accountability, local oversight, that is one of the values we try to uphold. But we're meeting in public.
Any other questions?
Oh,
Mark?
With the housing situations, rural counties like ours have a difficult time getting affordable housing, which is normally determined as apartment rentals. And One of the reasons is because the local units of government don't have the infrastructure there to put in large apartment buildings. They don't have the sewer and water capabilities. If they do allow them to come in, it comes to a cost of the township or the people that are residing around there if they're already on a sewer system and it has to be upgraded. The cost gets borne over all those people that have been using it for the many years. And is there some kind of legislation that could be offered at some point where some of these, I think what I understand right now is you can't force the developers to pay for that cost. And so if we could get some kind of legislation that would open the door so that that cost can be spread to those builders at the time that they start to build, instead of spreading it over the cost of all the users that have been on it before, that might be a step towards improvement. And then some of these neighborhoods might be more receptive to having that type of housing. And usually it's better towards a, not necessarily a city, but an area where there are shops and things like that, so it's more accessible than other areas, but
Yeah, I mean, housing's a giant issue.
Yeah.
And I would also say my philosophy on decentralization would apply to this area as well. So, I mean, if you're gonna put in a development and you're gonna have to expand the infrastructure that goes into it, someone's gotta pay for it.
right.
It's not magically gonna just have the capacity, so. But I haven't heard the issue of developers not being able to pay for that before, but there's lots of proposals out there. And I appreciate that feedback.
That was what I was told by a supervisor recently, so good check on that, guys. Thank you.
And just to piggyback on that, I think part of the homeowners that are in the area feel like they're paying for part of the construction or the foundation of it, and they're not getting any of the profits. So they're paying for a developer to have this infrastructure, and the developer develops, it makes the money and goes on their way, but it's still stuck with the individual homeowners to pay for it. That's kind of backwards. So, we do need something to address that.
I'm a behavioral health provider in our community and started in Allegheny County about 9 years ago. And it is really interesting that we're not considered like that rural underserved staffing shortage area, because as someone who serves this community, if I'm unable to see them, it's really OnPoint, right, that I'm referring people to. And while changes in our systems and processes, you know, we want to be prudent and have, you know, reform that's helpful, I really ask that we're really considering our most vulnerable constituents, our most vulnerable members of our community, that they're not going to get lost in this process. And I do have concerns that when these changes happen, like who's going to make sure these clients are not falling through the cracks, because it is our community mental health system.
Yeah, that gets back to having kind of the locals drive the services that helps mitigate a lot of those risks that you're talking about.
Absolutely.
Yeah, I worked with the court system for a while, and every time the courts here in Allegan needed something, as far as mental health, housing, anything, OnPoint was immediately the place that we would go to, because there was nowhere else. I was a caseworker for the court system, and anyone who was homeless, it was like, what do we do? Where do we send them? They need shelter. I remember specific cases that OnPoint, before I was a board member, helped find housing during winter storms. And because they had nowhere to go, and the people here went above and beyond that. Had they not been here and I'd not known about it, I don't know what would happen to those individuals on my caseload. So when I was hearing that the RFP could possibly do all these different things, those are the individuals that I was thinking about. And just thinking of how they might become disenfranchised and not get those services, because here in Allegan, OnPoint is the place that literally everybody comes to. And that's not a joke, that's not making it bigger than what it is. I worked for Head Start for a number of years before OnPoint was OnPoint, when it was still Allegheny Community Mental Health. All CMH, that's what we did when someone needed assistance. Then going to work in the court system when we needed something there. The judges were coming to me, asking me, because I got one person in here that I found, and that individual was like, call us, we have housing assistance, we have this, that. There were so many resources that they provided me that then I gave to everybody at the court system. So when judges even had people coming in for, domestic issues, criminal cases, and they would say, oh, this individual might need this assistance. I get an email from the judge. Hey, Jess, do you know anybody at OnPoint that could help? So for a county like ours, it is so important that all the services remain with the county and the local individuals. And then taking us off of that, like say we're not, off the rural status to get that extra assistance. Like right now, we have so many openings here. We're not gonna get a caliber of individuals that this area deserves if we're not there. Like, that's really hard. And then we have universities nearby. We have Western, they have an amazing social work program, but you're competing with Kalamazoo, Battle Creek, and then here's Allegan, kind of in the middle of nowhere. People don't even like, where's Allegan? Oh, we're just south of Holland, or the southern part of Holland is in Allegan County. So it's so important, and I really hope you take this back and talk to your other colleagues. Rural communities need places like OnPoint. They need CCPHCs. I've dealt with so many individuals just in casework, and then back to all the years that I worked, almost my entire adult life, it's been working with families and children from all the different jobs that I've had. It's always been working with family and children. And in Allegheny County, and working with them, this place has been the one that I've always reached out to. Because other ones, they wouldn't take their Medicaid, different organizations, or they had to travel too far and the people couldn't get there. Because Head Start literally worked with, there was the motto, the neediest of the needy. These were people that had to prove that they were living in poverty to even get into the program, because that's what it is. You have to be at or below the poverty guideline. Then I go to the court systems and work there, and I worked in child support. That was a whole nother thing, but helping those individuals so they can pay their child support, and then maybe they couldn't because they had mental health issues, substance use issues. Where did I send them and help them get a relationship with? It was to OnPoint. And then that's when I finally decided that maybe I should be on the board to try to make even more of a difference.
Yeah.
But to hear all this RFP stuff, that was really, really concerning, that the state was just like, we'll just change it and throw everybody into an uproar. And each area of the state is different. So these 3 regions, we're gonna lump you guys all together. I just don't think that's a thing that is feasible. So I would really encourage you to kind of think of that way when any of this stuff comes up.
Yeah.
Because there's families who OnPoint has helped who now have homes. Like I had one family specifically, it was a man and a wife, their children, they were living in their car. Camping is what they told their kids. And it was staff from here from OnPoint who went out to the campground and took them the things they needed. Like they have a closet here that had backpacks filled with socks, undies, they had sleeping bags.
I mean, sometimes in government, there are programs that are such a failure, you have to stop doing them and come up with something else. CMHs are clearly something that have been integrated into communities for almost 70 years, so just kind of pulling them out suddenly is probably not the most prudent way to do that. So thanks for sharing. Yeah.
The flip side of this is the people that we serve, we're not here to serve them. They end up in a more expensive place, which is the house that we have down on River Street, correct, Mark? They're in our correctional facility. And it costs a lot more for somebody that's sitting in there than somebody that has been deterred and vetted and put over here in OnPoint, where we can take care of them, get them back on their feet, get them the proper medications. We've just finishing up a mat room here, so if somebody gets addicted, we can get them back off of it, get them in a productive life. And there's a lot of things that this organization in Allegheny County is so expansive and does so many good things that disruptions such as this, where the state department has the ability to just clean slate this, and made the mistake of messing with the local entities, where that balance between them sitting in jail, trying to get back out and getting their life back together. We have mental health court, we have sobriety court, we have all these other things that we support, and see, Community Corrections Advisory Board sees all of this, that we're, from that angle, we're trying to keep all those avenues and that communication going between OnPoint and all the rest of the supportive agencies that we have here. But this needs to be very acutely looked at by the legislature and all of our legislators that serve Allegan County. Make sure that this isn't just a vendetta at the state level, or something that, well, if we do this, we don't have to put as much money into it. This has been a chronic shortfall of the MPHHS to not fund this correctly with the data that they have. And Millman is Millman is the one that sets the rates and all these other things. And they need to be boots on the ground out here where the work is really being done as to what it really looks like, how these things are coming through the budget, and having the state look at this a little more closely than just thinking, oh, this is what it's going to be for everybody, because each one of our counties are unique, and we have unique individuals and communities that the state is trying to support, but needs to go and be in a better position to know exactly what's happening on a local level.
I mean, I've been doing this, like I said, for almost 10 years now, and I've done various reforms. The reforms are very, very hard.
Yes.
And by the time you get done, sometimes it doesn't feel like you got much to the finish line, but then you look back 6 months, 12 months later, and you're like, oh, actually, that I did get more than I thought. So that's a little harder than just doing a single RFP of your own idea and putting it out there.
Well, the last comment I have is I do thank you, Senator Albert, for the work that you're doing in Lansing on our behalf. And we appreciate everything that you do.
Thanks for the invite. Thanks for wanting to be here. And thanks for all you guys do.
I've been here 9 years, and you're the first senator or representative that's been able to come to our meeting, or a meeting of ours, to be able to talk about anything. We have 9 or 3 senators, 6 representatives, and you're the first, so we would appreciate that opportunity to talk with you about it. Unfortunately, none of the senators or representatives that cover Allegan County have been really in key committees that oversee, other than I think Representative Vegas is on one, chaired one committee of related oversight for DHHS. But in general, we work through like health policy committees and so forth. And none of our representatives have really been on those committees. So to the extent that you have friends and colleagues that are, we really encourage you to help them take our needs and issues into account. And we'd be happy to, come and talk and, express ideas either directly or through our association or whatever it might be to make make sure that the fit's right on any changes that come forward, because it means a lot to the community. So
Yeah, and I'm on a lot of budget committees. I'm not on the DHS budget, but I am on full pro. So
yeah.
those are, if you can move on,
Sure.
point your appropriations questions my way, I suppose.
All right.
So,
We really do appreciate your comments. It's a really great thing to be able to.
thank you all for your time.
Thank you. Thanks for working out if you don't mind.
Sure.
And you can just keep on going if you want.
Okay.
Okay, now we're gonna pass out a whole bunch of stuff. So now I want to turn to, nope, I don't. I'm gonna do this first. Let's do the nominations, okay? So, we have had a recommendation of a slate of nominations for the different officers. And it's basically, we're all willing to continue to stay on as our, in our offices, but I wanted to have an opportunity for anybody who wanted to make a nomination from the floor for any change in officers. Hearing none, then I would entertain a motion to put forth the slate of officers that, basically the motion to, accept the recommendation from the nomination committee, which was to retain all the officers currently in their position for another year. Does anybody want to make that motion?
I motion to retain all the current officers for the next year.
Or you support? Any other discussion? Are you sure nobody else wants to?
Just to comment, the reasoning behind, keeping the current officers there is because we're going through a, CEO, search, and, disrupting the officers at this time would be counterproductive to that. So personally, I really appreciate, everyone stepping up and wanting to stay in those positions. I know that it's a hard job because I've done yours. And, I know it's a hard job because I was chair of the recipient rights. So, keeping those officers in place is, I believe, is very much beneficial to OnPoint at this time.
Thank you, I appreciate that. Any other discussion? All in favor, say yes.
Yes.
Opposed? Motion carried. Okay, now, talk about our CEO search. So, we've had two, CEO search committee meetings, and I wanted to, pass out some information from that. So one is, so this is just another, copy. There's only one tiny little change that that the search committee recommended to the changes that we were recommending to the actual job description. And that is, it's on the second page, no, on page 3, I should say. Under the required education and experiences, we talked a little bit about it. It previously said on the second bullet, 7 to 10 years senior management experience. And we discussed that a little bit and we thought, why, maybe we should open that up just a little bit, because maybe someone's only had 5 years experience and yet they're really academic, and we wouldn't want to not consider somebody who had like 6, and didn't quite have 7. So that is the other recommendation that we are making to the board in their approval of the job description for the CEO. And I wanted to ask, was there anyone else who had a recommendation for any changes that they would like to propose making to the job description?
There's a small grammar edit on page 2.
Okay.
Underneath the second yellow highlighted line, it says participants to the LRE. I think that should be participants, the Literature Regional Entity.
I believe you're right. Good catch. Okay, anything else?
I just had a question for the pay grade. It says contract. Are we going to be choosing a salary range?
Yep, and that's the next page. I wanted to, and actually, maybe I should send that around too before we go ahead and vote. Because, send it that way. We asked HR to give us, some recommendations for what would be an attractive, salary range. And we got this, bit of information that gives us, the current rate. They surveyed, other CMHs in Michigan and kind of an average of that. Other nonprofit healthcare agencies that are roughly our, size. And then this last thing is the HR's recommendation for what they would recommend we would list as, post as a salary range for this position. And the search committee moved to, support this recommendation. Any discussion or any questions about that? Go ahead.
Well, I was just gonna ask you if you wanted a motion on the salary range so we could have discussion, but you don't do discussion already. so-
Okay.
Okay.
Any questions? So I think what I, just for brevity's sake, I would entertain a motion that would say, I move to support or approve the current job description and salary range. We talked at length about, we really need to put that in the job posting as opposed to waiting till we get applicants and then talking about it later.
Make a motion to approve the job posting and the recommended salary range for the posting for the OnPoint CEO.
Motion, any support? Support. Support. All in favor, say yes.
Yes.
Opposed? Motion carried. Then I wanted to also quickly pass out, this is the draft minutes from the search committee. And I just wanted to go over a couple of things, other things that we talked about, just to keep you up to date about what we're thinking. And primarily it is the on the back, what we're, it's the part about where we're gonna use, our HR, and they're gonna send it out to their normal places that, yeah, and including like Indeed, CMHA has on their website, they have a place where they have job openings. We can put it there, and that way then all CMHs in the state would see it there. Is there any, I can't remember if there was any other.
I think it was Indeed and LinkedIn that we probably have to pay for a posting on, but to get it out there, and the CMHA job board.
Yes.
And then Raymond if necessary, depending on the flow of applicants that come in.
Right. Our website, there it is, our website and any social media that, like Mark has or anybody that, other CEOs that, he would have, that would be somebody that might be interested to then pass it on to their staff. And then, so then the process. So what we're talking about doing is, given that we have an approval tonight, we wanted to, put things together, and at the next, we're gonna meet the search committee is gonna meet again on March 30th. That's the next, I thought we were gonna meet on the 30th, weren't we?
27.
27.
Oh, that's right, we could meet on the 30th, that's it. That's right. I know, I was thinking that was like next month's meeting, but you're right, April and March. Okay, we're gonna meet on the 27th. And HR is gonna give us the final draft of this is what the job posting is gonna look like, and we can have a final approval of that. And we're hoping to then have it posted. We're thinking like April 2nd. We don't want to jinx ourselves and make it April 1st. And then once applications come in, the HR department is going to collect those. And they will be looking at our, bottom line minimum, the actual requirements, and kind of sort just that amount for us. Yeah, and so that, and like one of them is gonna be that you have to actually come to work. You can't, live in India, right, and do this job. And so like if somebody applied and that's, that would be kind of screened out, but then they would collect all that for us. Then the search committee would look at those applications and start to, evaluate them. And then we'll keep the board, and so that's in general what the process is gonna look like, and we're hoping that we'll get, I don't know what to hope for. 20 or, yeah, just a good candidate, right?
Just one.
Okay, one, all right.
That's what we need.
Yes.
So when they're screening out the applicants that apply, are they going to screen out everything that does not exactly meet all of the job description? Or are they going to say loosely, it's closed? Check it out.
I think what we've been talking about is, there's gonna be like 2 or 3 things that are like the absolute, they need a master's degree,
Yes.
right? They need, they need to be able to, I don't know, drive or something, and so it would be a very, very minimum amount, bottom line, these people qualify.
Gotcha.
And then we could take it from there. Fine.
Meeting the minimums is really
Yeah,
the threshold.
right. Gotcha. Any other questions? All right, well, keep your fingers crossed and we will let you know. I think that's all I needed from the search committee. Yeah. Okay. And I think that was all of my executive report. Now, Mark.
Oh, man, I was thinking I was all done. Did you approve you approved the bylaws, the board policy? Did that get approved too? That's a second document that you had in that file.
I was kind of hoping we could do them both, but I think you're right. Gail did just technically just say bylaws, so do you wanna?
No.
Let's just go
I
ahead.
thought you said bylaws
Set and
and
policies. You have a,
I have just who motioned and who approved for that. Write it down.
I thought that he did.
I can go back and look.
Policy as well.
thought you did 6:1.
Well, I thought that I did the policy, the bylaws, and that Alice was gonna bring the policies and procedures next. And
Okay, so let's have a
we were
separate.
interrupted by,
Okay,
But not to-
okay. I will entertain a motion to approve the policy and procedures as presented to us. Gail, you want to do that too?
yeah, I'll make a motion to approve the policies and procedures as updated on March 17th, 2026.
Support? Support. Any other discussion? Hearing none, all in favor say yes.
Yes,
Opposed? Motion carried. Now,
I was walking the senator out. Did you do the nominations?
yep,
Okay, thank you.
did do that.
All right, I will promise to keep my report absolutely minimal. I continue to, the update on the board openings piece. I think I shared this with the executive committee in more detail, but, working with a couple of, identified people that I haven't identified, but, my colleague at the, Intercare office in Gophers, no, in Pullman, has said she has, names for me to consider. I've also, so there's 2 there. I talked with Patty, also at Beautify Pullman, who has a board meeting tomorrow. She has, said she will let me know if she has any takers tomorrow, to recommend. I did have one applicant that it's not my role to disqualify them, but I let them know that I would doubt that person not being an Allegan resident would be eligible to be elected, so I let them know that. Another one, who's kind of in the works, someone who submitted an application for OnPoint as well as a couple of other county committees, boards. I sent a note back to him just saying, thanks for your application, eager to know a little bit more about you, and asked for a little email dialogue and haven't got a message back yet. So, but I'm hopeful that the first 2 that I mentioned will still produce some interesting, and interesting candidate from the southwest corner. So that's what's happening there. The only other thing I wanted to just, highlight, was my plan. A couple of months ago, several months ago, in the face of the state's RFP, you authorized joining, together with a number of other CMHs to create a new regional entity called My Plan. And that group has been, that group submitted a proposal to the RFP. which then got kicked out because the RP got withdrawn. And the question has been, so what happens with this My Plan organization, which is about 20 different CMHs? The decision, we had a board meeting last Friday, and the decision that was made there was to do nothing to either, evaporate the organization or to do anything else with it at this point, because there's still a lack of clarity about whether or not the department will issue an RFP yet of some other stripe that meets the law. So the idea was to hang tight until we know exactly the direction that's going and to make sure that it's not necessary to have such a group together to do a collaborative proposal. So that's the update on the My Plan movement for now. And that's really all I'll add at this point.
Any questions for Mark? Hearing none. We have another opportunity for anyone from the public who wishes to address the board. Anybody online? You're nobody. Okay, let's go around the table for any comments from board members. Jane, you want to have anything? Any last say?
I would like to say in the last 3 years, I have really learned a lot, enjoyed working with all you board members. When I worked with MDHHS, I worked in Ottawa County and I saw CMH and worked with CMH over there. And it just seemed, because they had like a compound of different buildings that worked with each other, and coming here to a rural setting, it made me realize that just because you're a small community, you guys have so much to offer. I think even more so, you really focus on offering so much to the individuals within your community. I'm very impressed, and I know whenever I told people that I was on the board at OnPoint, I was super excited and explained everything that we do in our meetings. So thanks again for allowing me this opportunity. I really appreciate it.
Well, thank you, Jane.
Yep. Thanks for your strong comments to the senator. I think those things needed to be said. So thank you.
No comment, Crystal? What?
Happy St. Patrick's.
I just want to make one comment that, so I talked with Jane and Jane talked with the members of the program committee and was kind of saying, well, who would like to possibly step up to be the chair? And I talked with Kim, and Kim said she was comfortable staying right where she's at. And so, Jane let me know that Jessica has said, yes, she would be willing to be the chair. So I'm going to appoint her as the chair of the program committee. And I'm so glad to have you.
Wrong one.
Okay, Gail?
Number one, move to confirm Jessica as the chair.
All right. I can't just do a little.
No.
I move that we,
I forgot your one, that's why.
yeah. I move any support in.
I support.
You support. I know. No discussion, right? All in favor, say yes.
Yes.
Opposed? Motion carried.
And the rest of my comments is thank you, Jessica, for stepping up. I have seen in my tenure on this board, people that were willing to step up and be leaders and to voice the concerns of their family members and people that they serve. And Mark and I as commissioners, bringing the concerns of the entire community. And I appreciate all that input that comes in from everyone here. Thank you, Jane, for your service here on this board. I've appreciated your insight, leadership of the program committee. Thank you and best wishes in your endeavors. And the end Happy St. Patty's Day. And be safe going home on these roads.
Yeah.
For sure.
Don't be speeding. Watch for the deer
That sounds like
and
that.
stay away from the beaver. If anyone has time tomorrow, that, or not, yeah. Thursday, I'm sorry, Thursday, my days all mixed up nowadays. But, Thursday, the Allegheny County Community Foundation is holding their volunteer fair at the silo from, I believe, 10 till 2. That's correct.
Yes.
That's what I have on my calendar. I could put it in right. But it's a good opportunity to see what volunteer groups are available to come. Get a little goodie bag of items at hand. And thank you for all their serving and support.
I would like to thank Jane for everything she's done, and I would like to thank you for sending, I think you really put that in the job. You always ask awesome questions, so. Very thoughtful.
Well, Jane, thank you. But do I get a wand or anything?
And these were passed out, you had.
No, just, it's been great and I'm glad to continue to be here and we'll miss Jane. I guess I got something to do.
Great. All right. I'll entertain a motion to adjourn.
Move
to adjourn.
Second.
All in favor, say yes.
Yes.
Opposed? Motion, I know.